Hi there, congratulations with being invited to an interview, to a Skype interview. It might be your first Skype interview, so I'm sure you are feeling a little bit nervous. I therefore wanted to do this video so I can just put your mind at ease and make sure that you know exactly what to expect from being interviewed. Skype interviews will usually be with a panel of two. Most of the time you will be interviewed by two people. And remember, just as much as you feel nervous, they feel nervous seeing you. So it's all the same experience. The employers in the UK are not conducting interviews to try to catch you out. They very much understand that your skills overseas will be different. Most probably many things will be different from how they do it here. So it won't be a difficult interview. It will really just be an interview about getting to know you. What we want you to do for your Skype interview is, before the interview, we want to make sure that all the technology is working. We need good internet. And if you don't have good internet at home, maybe you can think of booking a hotel. Many hotels have internet facilities available, and you can do the interview at the reception of one of the hotels. Just go sit in the corner, ask if you can have access to the internet, order a coffee and do your interview just there. Because often hotels' internet speed are a little bit better than what you might have at home. So it is quite important that you are in an area where you've got good internet connection, that we test your camera, making sure that the sound and the camera is working fine. It's very frustrating if you are talking and they can't understand, they only hear every third word. We will help you to test your Skype before the interview, and our consultants will make sure that we give you the best advice on how to set up your Skype. On the day of the interview, we want you to be available about in a period of 2 hours. So the interviews sometimes have technical problems and it can be a little bit later, or somebody might have dropped out completely and we will need you to fill in a little bit earlier. So we will give you an interview time slot, but if you can make sure that you are available like at least an hour after, an hour before that time slot, that will be very, very helpful. And that way we can make sure that you are being interviewed on the day. Before your interview, you always have to know what you have written in your CV. So it's very good practice to maybe just have a look at your CV or have a printed copy of your CV, because the first part of the interview, they are going to ask you some questions about your experience. Think about your experience before, and what's very important is that you think about your experience, then look at what the employer is all about. So, for instance, if we book you for a private hospital job in the UK, you have to know what kind of units that hospital have, what kind of facilities, so that you don't try to sell skills that they might not be looking for. If we book you for a care home, you need to know that the care home is all about elderly care, and there's no point in you selling your maternity midwifery skills to an elderly care home. So think about your own skills, make sure you know what the employer is all about and what they are looking for. For overseas recruitment, most of the time we are not recruiting you for a specific unit, for a specific ward. We are arranging interviews on a head office level, and they've got a lot of hospitals, so they will listen to your skills and then match you to one of their hospitals. So this will also happen sometimes, but at least you need to know, is it a private hospital, is it a government hospital, what type of units of facilities this hospital offer. While I'm talking about private and NHS hospitals, private hospitals in the UK are much smaller than NHS hospitals, which means they have mixed skills wards. So they won't have just a medical ward, just an orthopedic ward, just a cardiac ward. In a private hospital, it's common that you will have all those disciplines in one unit. The theatre will be the same. It won't be just the orthopedic or just the ophthalmology theatre. Care homes in the UK are facilities where there is no doctor around and where the nurse are making the nursing diagnosis, and care homes are for the elderly. So your skill set and the things that you want to say to them in the interview about your experience need to match with what you know they are looking for. So if you're interviewing for a care home, you want to sell your experience with elderly. Even if you don't have specific care home experience, you will make sure that they know that you have worked with elderly residents or elderly patients before. So it's to bring that to a conclusion, it's very important that you know who you are being interviewed by and what are they looking for, so that you can bring your transferable skills to them. The employers, if you ever in an interview say that you don't know anything about them, I think that will be a very fatal. You have to show the employer that you've researched them and that you know why you are applying for this job and why you want to work for them, not just for any employer in the UK. Little other things that they would want to hear from you. Why do you want to work in the UK? What made you decide that this is a good career move for you? Some employers will ask you some examples. So they would like to say, have you ever worked with a difficult patient? Can you give us an example of a time that you've worked with a difficult patient? So I'll send you a little attachment with some questions that you can think about, frequently asked questions that you can maybe even prepare. There's no point in thinking that you can write down all the answers and have it all rehearsed on the day of the interviews, because we don't know what employers will ask. Every employer is different. Every single interview is different. These questions that we are sending you are really just to give you guidance of what kind of questions UK employers like to ask. So the most important thing is for them to get to know you. So on the day, if you can try to relax as much as possible and try to just be yourself and understand that they are people just like you. You will be interviewed by other nurses and they want you to do well. The great thing about when you apply for a job in the UK, you are not competing. There's 30,000 vacancies in the UK. Every single nurse that are being interviewed, there's a job for you. So it's not a competition. You can completely relax, be yourself, make sure that you bring your best skills and personality to the table. Interviews are all a little bit about bragging, and I know this is not something especially nurses like to do, but in your interview you need to make sure that you are selling your skills and you are selling your experience. This is not the place to be modest. This is the place to make sure that they understand that you are a nurse, a confident nurse, and that whatever you don't know and anything that they ask you that you don't know the answer, you will do exactly what you will do at home. You will say, well, I will find out. I will do research. I will make sure that I know. I will ask another professional nurse to show me, and then the next time I will know. So nothing to be scared of. It's not fatal at all to say that you don't know the answer to any question that they might ask you, as long as you have the right attitude and that you convince them that you are a fast learner and that you want to learn. If anything happens on the day of your interview and you can't do the interview anymore, it's only good manners, but it's also important that you let us know at MMA, because employers or unit managers, theatre managers, care home managers are very busy people, and you must know that there are two managers sitting and waiting for you at that slot of your interview. So if you can't do it, don't feel bad about it. Just let us know. We can always book things for you at a different time. We can always reschedule it for you, but just communicate that with us and let us know in advance, so that we don't waste the time of the employer, and that will also not be good on yourself, giving you another chance. If you're simply too nervous on the day, again, it's fine. We understand it. We've supported many nurses, so it's just about communicating it with us and letting us know in advance. One thing that employers like to ask you will be questions. Have you got any questions? And when they ask you this question, they really want to see whether you have thought about it, whether you have done your research, but you have to also watch out what questions you ask, because we hopefully by now have already provided you with all the answers. We have given you information about accommodation, flights, and how things will work. And if you still don't know, I think it's important that you talk to us before doing the interview about how things will work and about questions you might have. So on the day, I just want you to not ask questions like, how do I register with the NMC? Because that's part of things that you should have thought about before the interview and could potentially, cost you the job. Also, things about what accommodation you offer, and will you pay for my flight tickets for my children? Things like that are also not good to ask at the interview, because again, we would have wanted you to know that in advance before you have agreed to take the part in the interview. Salary, again, not a good one, because you should have done your research before agreeing to the interview. MMA try to provide you with as much detail as possible, and these are the kind of questions you should ask our consultants before accepting the interview invitation. Things that are very good to ask will be questions about training opportunities. Every hospital, every care home, every unit have different career development programs. So it's a good question to say, what kind of career development does your unit offer, or will your hospital offer me? Usually employers love that question. It gives them a chance to brag a little bit about what they can offer you, and you can learn a lot from them. Can you tell me a little bit about your unit and what type of patients you have in your unit? That can be potentially good questions, unless it's something that you could have read on the internet. And do you have other overseas nurses in your hospital? That could be a good question. You just want to know how diverse and global the unit will be. So watch out to ask questions just for the sake of asking questions. If you don't have any questions, you can say, actually, MMA's already answered everything that I wanted to know, and this is why I've agreed to this interview, and I don't have any questions right now. But watch out to ask questions that the employer feel you should have known.